Hi, I'm Dr. Angela Darragh. I'm a naturopathic doctor, and unlike popular opinion might be, we are real doctors. Our first 2 years of medical school are exactly the same as the MD medical school because we learn first, how does the body work? Second, how does the body break? What are the appropriate diagnostic steps to take? Labs, imaging, yada, yada, yada. What really changes is the second 2 years. And in those second 2 years, that's when we're actually learning our therapeutic models. It turns out we have to get introduced to a lot of them because many, many, many exist. If you've seen more than one naturopath, you might have noticed that they're all pretty different. Some have become infatuated with herbs, other nutritional supplements, others focus on the mind-body emotional connection or acupuncture. And the reality is these are all useful tools. It's just a matter of which one interested that particular student. So our second 2 years of training is actually probably more difficult than the second 2 years of a conventional doctor's training. I don't want to sound rude or arrogant about that, but when I look at it, I'm kind of pretty certain it's that way. Because we have to learn pharmacology, and we have to learn an introduction to herbs, an introduction to nutrition, an introduction to physical medicine, an introduction to mind-body medicine. The list goes on. And then the things that we want to excel at, we study more because we're fascinated with that model. I love to teach my own specialty because I'm fascinated with the model of it. However, there's so much that a naturopath can offer you that you might not be aware of yet. First of all, we are trained to look for the root cause of disease. You might have heard this a time or two before, but it's a little bit confounding to people to understand how deep we dig to find that root cause. Sometimes that root cause looks like it's inflammation, but it's the provoker of that inflammation that's really the root cause. Sometimes it's stress, but it's what's bringing you your stress that is the cause. Occasionally on clinical shifts we would joke about a husbandectomy, maybe in line. Just joking, don't do anything dramatic with your life or your household, but my point is, our root causes can look a little bit different. The, quote, allopathic model is where they come against things. Oh, your blood pressure is high. This will make it go down. Oh, your inflammation is high. We're going to suppress it. Oh, this is up. Must go down. But why is it up? What else will happen if you smash it down? Have you ever played that pop-a-mole game? Boop, 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 boop. That's exactly what happens if you start suppressing symptoms. You might get the blood pressure down, but how long are the kidneys going to handle that? Where else is that stress going to culminate? If you don't treat the root cause, are you really actually serving the patient? As far as I'm concerned, and I might get a lot of interesting feedback on this, our current model is hurting more people than it's helping in our conventional medical world. I have to consider this as a truth now that I've been in practice about a decade, because I have to treat the people who got broken in the system. They don't tend to find me until they've run out of what their insurance will cover, and I've renamed insurance policies in my mind as disease management policies. Why? Because they want to give you a diagnosis and then maintain your care of that diagnosis. Why else do you have to go in every 3 months just to be assessed, to increase your medicine, to redo your labs, to increase your medicine, to redo your labs? Are they truly helping people? Or are they treating the paperwork because they've fixed the diagnostic finding? Now, granted, I have a lot of respect for a lot of MDs out there too. I wanted to be one, believe it or not. I was planning to be a trauma surgeon through most of my pre-med career because I kept digging for the root cause, and I decided I wanted to work with trauma victims because I'm really good when people are in crisis. I can think clearly, and I like to work with my hands. A background in carpentry makes me really good with my hands. And I also love the human heart. I've worked with children for a long time. Turns out all of our hearts have the same needs, whether you're 5 or 55. We all need to feel loved. We all need to feel heard. And we all need to feel like we have a role in this world, an identity. Those are some of the fundamentals that seem to come up when discussing our stress management strategies. Usually we have to train the way our brain is thinking and our heart is feeling in order to set a new tone. Clinically, people come in all of the time with issues that I call are underdiagnosed. They're typically said, well, it's probably in your head, maybe I'll give you an antidepressant, and they're just still not better. There's no lab to find out their root cause. But if we consider the way the body is supposed to work first and honor that process through our process of deduction and what we call our differential diagnosis, we want to truly consider all of the things that can possibly be wrong. If a person has high blood pressure, what else is going on in their life that's making that happen? There could be a number of things. If a person just has headaches, how vague is that? Did you know headache is a diagnostic term? Headache? Headache. Does that tell you anything? I'll tell you, I get headaches from sleep loss or coffee withdrawal or, who knows, muscle tension. It happens over and over and over. And so in my mind, a symptom of headache is a symptom, not a diagnosis. And so a trained naturopath who's gone to a 4-year school will run through what we call our differential process to make sure that we have scoured all of the root causes for this. It takes us 4 years and $250,000 for this expertise. So if you really think you're going to find it on Google, cool. When you run out, look up a nearest naturopath. Make sure they went to a 4-year program. There are some online things that are a bit shorter, and I'm sure they learned some handy-dandy stuff. But the diagnostic differential is really, really important. One of the books that was recommended during my first year of study was called How Doctors Think. This book was written for patients. It's to help them guide their own physicians through the differential diagnostic process because, as human nature has it, what we really tend to do is verify our first assumption. If you've seen this 90 times, blah, 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 you think the next person that walks in with a similar presentation has that diagnosis and you're the expert, because that's what you see all day. Even radiologists have a fault with this. It's a little bit scary when you read the details of that in this book, How Doctors Think. But it enlightened me to the importance of differential diagnosis. And through doing this clinically, what I found, there's often more than one thing happening. There's something in our human nature that's satisfied with finding something. Oh, we got an answer. But what if there's more than one thing going on? What if a person has a bacterial infection and a viral infection? Which one do you treat? Probably both would be important. How do you treat that? Antibiotic? Really, it's about the health of the tissue, whether or not the bacteria or virus will thrive. In our naturopathic model, we look at what we call the milieu, the environment. If that environment is already diseased, bacteria will thrive. A few things that will disease the tissues, well, one main thing is sugar consumption. High fructose corn syrup, refined sugar, these are a problem for our immune system. They're a problem for our body. Another thing is constant chronic low levels of stress. And this is because in our culture, we're constantly moving on to that next task. We put out a fire, move on, put out another fire, move on, put it out, put it out, put it out. Instead of, hey, I did it, celebrate that win. Brennan Bouchard is an excellent author on how to actually celebrate your win and use that momentum to go in a healthy new direction to accomplish the next task. But if you don't pause and celebrate that win, your nervous system is still in survival mode. The analogy I like to give is if a baby is really close to the stairs and you grab them just in time and you embrace them and they're safe. Celebrate that safety, celebrate that moment, let that actually calm you down. Even the hunter-gatherers, once they finally caught their prey, I'm sure they would celebrate that win in their own way. Usually through community, because who's going to eat a boar all by themselves? There's probably 30 people that they got to share that with, and there was gratitude and celebration and victory. That's really, really important for our human heart. So, constant, chronic, low levels of stress will reduce blood flow to the tissues. Even the World Health Organization has recognized that it's the cause of over 90% of diseases. So if I don't focus on your stress levels, I'm not serving your root cause issues. Because once we get the body out of survival mode and into that healing state, we can shift that gear. In our nature cure model, which comes out of German medicine, Naturopathy, is a blend of nature cure and homeopathy. They came together because they realized they needed each other. We want to take out what's causing the body harm, put in whatever's missing, and stimulate blood and lymphatic flow. We want to get rid of whatever's toxic, and we want to put in what is nourishing. We also highly agree that we should be using food as medicine. It's harder and harder to do that these days because our world is actually quite polluted. So in the past, if I could emphasize, I want you to eat a bunch of fish to get all your omega oils, that'd be great if I didn't know you were also going to become mercury toxic eventually. Granted, shellfish, super high in zinc, also probably high in some other heavy metals. So we have to use food rotation systems. The cleanest things we can really come upon tend to be some of our produce, right? And so we tend to use produce as medicine more so than animal products, just because the plants don't take up as many toxic elements as produce does. One really, really lovely combination for gut inflammation is a juice pressed from cabbage and carrot. These are naturally high in glutamine and beta-carotene, and these are the tools our body needs to repair a leaky gut. I've had fabulous outcomes when people are willing to drink something that smells like feet. I try to encourage them not to smell it. It tastes better than it smells, because the carrot really does carry it through. But the components of the cabbage juice soothe the gut very effectively. However, if you just eat cabbage, even cooked cabbage, the fiber in there can promote some extra gas and then discomfort, and we're kind of moving backwards. So often, if I need to move patients through a detox process, we like to use food as medicine, largely vegetable juices, but I'm also a very, very big fan of fruit. Fruit has antioxidants, which will reduce inflammation. And it has natural forms of sugar, which your brain and your nerves need. In my own training, because of the nutritional science at the time, it was advised that we avoid fruit in order to avoid sugar. I needed to correct my own type 2 diabetes. I grew up on a 2-liter of soda and a bag of Doritos over cartoons in middle school. Before we knew better. Now we know better. But there was a period of time when I only slept every other night for 4 hours. I had headaches most of the week upon arising. I would get shaky, my mood was a mess, my hormones were very imbalanced, and really it all came down to a problem with my blood sugar handling. But I was drinking Mountain Dew every day for lunch, and I was having sodas and sugars and blah, 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 because I was too tired to function otherwise. So I was using sugar like gasoline to get me through my undergrad days. I had a terrible sleep regimen. I had a lot of fun, I had a lot of friends, but I wasn't honoring my body because I didn't know how. Once I started the naturopathic program, I removed inflammatory foods like wheat, which really I think is a pesticide problem, dairy, which I don't think we do well on after we've outgrown breastfeeding for the most part, and sugar, just cold turkey on sugar. And within 3 months, my skin was perfectly clear, my mood was lifted, my energy was lifted, and then my body started moving through these healing responses. where I would purge the old toxicity that was within. One time, my roommate at the time made homemade cookies. I ate one, and I threw up 16 times in 2 days. Got a really wretched fever. It was not fun, but it taught me that my body has now learned this is not good for me. When I used to snack on cookies all the time, that is what broke me. It was finally strong enough to reject the thing that was provoking illness in me. It's a really good example of your symptoms serving you. We have been trained largely through television, which means to put your vision on another, that fevers are bad, that colds are not good, anybody who's going to get sick, blah, blah, blah. In our naturopathic model, if you haven't had a cold or a flu about once a year or two, something's wrong with your immune system. There are a lot of bacteria and viruses out there, and if you cannot mount an immune response against them, they will plague you. This is really common in autoimmune types of cases, and some of the difficult to diagnose things like chronic fatigue and fibromyalgia, their bodies are just so taxed from this constant chronic stress of a low-grade infection that they've never had the opportunity to overcome. Laying around and resting isn't as restorative as we might hope it to be. Sometimes we need physical rest, but sometimes we actually need a little bit of activity. We need to sweat, even if that just means taking a hot enough bath. We need to hydrate. Sometimes we forget to do that, especially in the winters here in Arizona. And we need good nutrition, and we also need an opportunity for our body to cleanse the pipes. We go through this in, ideally, maybe not all naturopaths know this, but I had a really fabulous teacher named Sarah Hazel who taught me that we need to have a restorative season where we're nourishing the body, replenishing the energy, and then we shift gears to a bit of a detox, and then we come back to a restorative season. Most of the time when people use the internet to search a detox process, they have not done the initial step of restoring their body's nourishment needs prior to pushing through that detox action. If you don't have the vitality to detox well, you can hurt yourself. You should not be getting really bad symptoms or feeling worse, really terrible through these processes. It's okay to have some symptoms, but we want your mood to be good. In our naturopathic model, we move through what we call a healing crisis. This is not a detox reaction. If you Google a healing crisis, it will often call it a Herxheimer reaction, which is different. The so perfect example of how sometimes the internet is inaccurate. There are two different things. If you have an infection in your gut, and we start to kill things off that die, the enzymes inside of those little creatures, or yeasty beasties, they are icky to us. We don't feel good. That is the Herxheimer reaction. It's normal and appropriate, and it does exist. But the healing crisis is different. The healing crisis keynote is an abundance of energy and a super positive mood the day before the symptoms present. Often the symptoms that present are things that were experienced in the person's medical history. A really good example are people maybe who have asthma. And all of a sudden, when they're moving through this process, they get eczema on their arm, but they haven't had eczema since they were 5 years old. This is something we celebrate. This is a sign that whatever was in their lungs is now moving out through the skin, which is preferred. You see, we see things heal in a certain order. We call it our laws of cure. Things will heal from the top down and from the inside out. The reason the top down is significant, one, has a lot to do with your mood. Two, your brain is the master driver. Your energy levels and your neurology have to help everything else work properly. This is why I am now a big fan of fruit in our therapeutic model, because I learned from firsthand experience that if you don't feed the brain glucose, it does not thrive. Not everybody will feel good on a ketogenic diet. Some people are prone to hypoglycemia, and those people need more complex carbs than the internet will say is justified. Feed your brain. Feed it with the right data. Train your positive neurologic process so that you can get out of survival mode and into healing mode. Clinically, we have a lot of resources for this. They will vary depending on which naturopath you see. Many of them are highly useful, but one of the biggest mistakes in medicine is to do the right thing, but not enough of it. The brain requires repetition over time. Have you ever tried to get in shape and gone to the gym every 10 days? Were you left frustrated? This is what happens if you don't commit to an actual care and restorative process where you're nurturing your body with regularity. And again, we all have different styles and preferences on how we go about this process. But it's really important that you get your mindset right so that your neurology can go back into that healing state. And then miracles happen. We can't predict what the body is going to choose to heal first. But we can trust that the body is smart and that it has the capacity to heal. Fundamentally, that's what really makes us different than medical doctors, is that we trust the body knows how to heal itself. For some people, this is a completely new idea, and that's why the first year of school we have to discuss what we call a paradigm shift. Our parents especially, well my parents anyway, grew up watching TV where there was a doctor with a white coat and he was the authority and he knew better than you, so you better do what they say. Does that sound familiar to you? Anybody experienced that tone lately when you've gone in to just establish care with your healthcare provider through your insurance or disease management policy? It happens, and they're not all that way. Trust me, I've met a few fabulous ones, especially ones that are a bit younger in years. They're much more open to the idea of working with the body than working against it. And I might be wrong by now, but at one point, not very long ago, medical doctors that were primary care providers had higher suicide rates than dentists, which used to be the highest from mercury poisoning. But now, I think it's just frustration. One of the patients I saw recently was a medical doctor, and she was very stressed, and her body was showing signs of degrading because of the stress in her life. I gave her a physical exercise to train her brain to feel rested, and 1 week later she came into my office a completely different person. It was like she was floating. Her blood pressure was better, her signs on papers and labs were better, her life is better now, even though she's routinely combing over pill protocols for people. But now she can do it with integrity because she learned the life hack of getting her brain out of survival mode and into that healing state. You can do it too. There's different resources. Sometimes it's an exercise protocol. Sometimes it's reading the right things, but the reality is naturopaths are highly trained in finding what is really that root cause that's driving the issues. Some are more skilled and talented than others, and just like you might have to shop around for the right mechanic, you might have to try a few naturopaths before you truly find your fit. We practice here in Arizona. Our website is stopfeelinglikeCrap.com, and due to the current cultural tones, we'll be offering more and more telemedicine services beyond the state of Arizona, even though I won't be able to operate in a diagnostic protocol. I can still help you get your nature cure protocol sorted.